What should you do if your menstrual cycle is irregular? As a fertility specialist, I talk about periods, reproductive health, and your body's rhythms every single day. Today, I want to dive into your period. How can you tell if it's irregular? What steps should you take? How long is reasonable to wait? What does the medical workup look like? And what do I, as a fertility doctor, really want you to understand? Before we get started, remember that this channel exists so you can truly learn about your own body. So please take a moment to subscribe, share this video, give it a thumbs up, and drop a comment. That helps our message reach more people who need it. To really understand whether your period is irregular, it's crucial to first understand what actually causes a period and how your normal hormones work. It's honestly heartbreaking that we learn so many things in school, like geometry, but we never learn about our own bodies. This is not difficult to grasp, and I'm going to break it down for you quickly in this video in a way that will make sense. I want you to think about the key players in your reproductive system when it comes to your hormones and your period: your brain, your ovaries, and your uterus. Starting with the brain, you have the hypothalamus, which acts as the control center. It sends signals to the pituitary gland. The pituitary gland is the real powerhouse that releases all the controlling signals that go to other parts of your body, whether it's your adrenal glands, your ovaries, your testes, or your thyroid. It's essentially the body's hormone distribution system. Then you have your ovaries. Inside the ovaries are tiny follicles, and the ovary itself has the ability to produce hormones. I always say the ovary is a hormone-generating factory. Finally, you have your uterus. The uterus has different layers, and the innermost layer is called the endometrium. The endometrium is the part that regenerates every month and then sheds. And that shedding is what you know as your period. There's a basal layer of that endometrium, which has the ability to regenerate new cells each month. All of this works together in a normal cycle. So the first thing I want you to understand is this. Let's focus on the ovary. Imagine that inside the ovary, there is a vault where all your eggs are stored. When you are born, that vault is full. Throughout your life, eggs come out of that vault, and when the vault is empty, that's menopause. You are born with all the eggs you will ever have, and you will eventually run out of them. Every single month, starting from the time you were a tiny baby inside your mother's womb, you have been losing eggs. An entire group of eggs is released from the vault each month. Each egg grows inside a follicle, so we often use the words egg and follicle interchangeably. Once you start puberty, the brain begins sending out follicle-stimulating hormone, or FSH. But all those years from when you were a baby up until puberty, a group of eggs, each microscopic egg inside a follicle, came out of the vault and simply died. So you were losing eggs that entire time. When puberty begins, the brain starts releasing FSH. FSH works to stimulate a follicle to grow, and that actually starts the whole process. The process isn't fully mature at the very beginning. A follicle starts growing and producing some estrogen, but you don't fully ovulate yet. That's the couple of years of early puberty when you grow breasts and develop secondary sex characteristics, but you don't have a period yet. Once you ovulate, you will start having a period. So FSH gets an egg to grow. As that egg grows, it makes estrogen. Estrogen, in a normal cycle, builds up the lining of the uterus. This is called the follicular phase, the time when a follicle is growing. When that egg is mature and has produced enough estrogen, about 200 picograms of estrogen for 50 hours, it tells the brain, I am ready. Then the pituitary gland sends out another hormone called luteinizing hormone, or LH. LH is released in a big surge, which allows the follicle to open up, rupture, and release the egg. That's ovulation. After that, the follicle reforms, and LH from the pituitary gland drives the entire luteal phase. This follicle now becomes a corpus luteum, a cyst that produces progesterone. Progesterone does what we call stabilizing the endometrium. It compacts the lining and gets it ready for an embryo to implant. Implantation happens after a certain amount of progesterone exposure, usually around 5 to 9 days. Progesterone helps open and close that implantation window. Now, if you are not pregnant, the corpus luteum can only live for about 12 to 14 days. It dies, progesterone drops, and that drop is the signal to the uterus to have a period. Boom. The body sheds all that old endometrium and starts fresh. If pregnancy occurs, the pregnancy makes HCG, which is what a pregnancy test detects, and that HCG rescues the corpus luteum, allowing it to continue making progesterone. That's how the body knows you're pregnant. I have lots of videos on progesterone if you want to learn more, but this is what is supposed to happen every single month, and so many things can go wrong. That's why I always say your period is a vital sign. It actually tells us a huge amount about your body. The caveat: if you're on birth control pills, an IUD, the shot, or the implant, all of that masks your normal hormones. I'm not saying that's bad. It's a personal choice, and certain types of contraception are very effective. But then your period is not a vital sign. That means if we want to understand how your body naturally works, we have to come off that contraception and see how your period returns. Your period is only a vital sign when you are not using contraception. I've had patients say, "Oh yes, my periods are perfect and regular," but they've been on the pill for 20 years. Of course, they're perfect and regular. That's what the pill does. You have to be off contraception to understand what your body is truly doing. Issues at any of these levels, brain, ovary, uterus, can cause irregular or abnormal periods. So let's break them down. A regular period is bleeding that is regular and predictable for you. If you bleed every single month between 27 and 30 days, that's perfect. That's regular, within a couple of days of the start for you. If your bleeding is irregular, it can be as mild as a change from your baseline, or it can be something defined as abnormal, even if it falls within what people call the normal range. If you Google a normal period, you'll see people say anywhere from 25 to 35 days is normal. That does not mean your period should come 25 days one month, 35 days the next, 25 the next, 37 the next. That is actually irregular. I call that irregularly regular because it's not absent, but it is coming abnormally. When I think of ovulation issues, I think of them on a spectrum. Let's go through this quickly. First, we have perfectly regular periods. Then we have slightly abnormal ovulation, which is actually a luteal phase defect. That's when you track ovulation, and your luteal phase is less than 11 days. Sometimes luteal phase spotting can be a sign of this. You might notice a shortening of your period interval. Used to be 28 to 30 days. Now it's 24 to 26 days. Second, the period starts to not come at a perfect interval. That 25 to 30 day range becomes unpredictable. Next, the intervals get longer. Now you have a period every 40, 45, 60 days. Then you start skipping full months over and over again, having a period only once every few months. Finally, you have frank amenorrhea. No bleeding at all. Different things can cause each of these issues. So what can cause irregular periods? From the uterus side, you can have abnormal bleeding that isn't actually a period but can be confusing. Things like polyps, fibroids, or even scar tissue where blood gets trapped behind it. That can cause abnormalities in your bleeding. So number 1, anatomic uterine factors. Number 2, ovarian factors. These can contribute to abnormal periods. PCOS, polycystic ovary syndrome, is a big one. In PCOS, you have a very high number of eggs inside your ovary. That normal signal of FSH gets diluted, so the ovary doesn't ovulate at predictable intervals. I have whole videos on PCOS. What starts to happen in PCOS is that the ovary shifts and starts making a lot of testosterone and other androgens, and you get a collection of other symptoms like acne, hair growth, weight gain, and insulin resistance that feeds the cycle. Another ovarian factor is low ovarian reserve, or premature ovarian failure. When your egg counts start getting low, you begin to see more irregularity in your periods. At the pituitary level, several things can go wrong. You can have abnormalities in prolactin secretion or thyroid hormone issues because the pituitary gland sends out FSH, LH, prolactin, and TSH. Abnormalities in one can actually impact the others. That's why we see prolactin and thyroid problems affecting the ovary. Then we have hypothalamic amenorrhea. This is where you don't have secretion of FSH or LH, but the problem originates higher up, in the hypothalamus, the control center of the brain. The reason? The body does not feel it can have a period. Malnutrition, eating disorders, overexercising, chronic stress, chronic disease. A variety of reasons. When the hypothalamus shuts that part down, it can take years and years to recover. Someone who had an eating disorder in the past might have period abnormalities or no period at all for many years after recovery. That's why it's so important not to delay seeking care. So when you come in with irregular periods, what does the evaluation normally look like? The typical workup includes 1. Looking at your hormones, typically AMH for ovarian reserve, FSH and estrogen to see if you're in ovarian failure or if the brain has turned off, TSH for thyroid, and prolactin. Those basic hormones help us understand. Are we running out of eggs? Is our brain turned off? Is the ovary not responding? From there, you may or may not need an anatomic evaluation. As mentioned, polyps, fibroids, or even overgrowth of the endometrial lining from not ovulating or endometrial cancer can contribute. Ruling out cancer with an endometrial biopsy is sometimes performed. There's also clinical history, looking at your ovulatory pattern or something called chronic anovulation. There's an in-between zone where none of these tests are perfect. Sometimes I think it's a mild hypothalamic issue. You're stressed for one reason or another, so your brain isn't sending out a strong enough FSH signal. That can sometimes be overcome with medications to help you ovulate. Obesity or excess fat cells can also cause chronic anovulation. Why? Fat cells make a type of estrogen, and that estrogen fools the brain. The brain thinks an egg is already growing, so it doesn't send out a strong FSH signal. Losing weight and decreasing that estrogen allows the brain to send a stronger FSH signal. There are other rare causes, like adrenal disease, Cushing's or congenital adrenal hyperplasia, which typically present when you're younger with other abnormalities. But the truth is, your period is a vital sign. If you're not on contraception and your period isn't coming at regular, predictable intervals, you should get an evaluation, even if you're not trying to get pregnant, because your hormones are essential to how you feel in your daily life. If you are trying to get pregnant, here is one of the most important takeaways. If you're under age 35, you should try for a year before seeing a fertility doctor. If you're over age 35, you should try for 6 months before seeing a fertility doctor. That advice is under the presumption that you have regular, predictable periods and are able to have intercourse. If your periods are not regular, do not pass go, do not wait. Go get an evaluation right away. Some of these issues are easily fixable, some take a while to treat, and some would cause me to advance you to fertility treatment immediately. You deserve to have the information you need. The last question I get asked all the time is about coming off birth control. Dr. Coffer, being on birth control impacts things. How long do I need to wait? I usually say you should come off any type of hormonal contraception 3 to 6 months before you're ready to conceive. That way, we can see what your period pattern truly is. By the 3-month mark, you should really be having periods again. If you're not, it's not that the birth control caused anything wrong. Remember, the birth control was masking the issue. It was allowing your body to have artificial periods, but now the reality is being revealed. It's time to get a workup, understand what's going on, and get treatment for it. No type of contraception causes these issues, but you may simply not be aware of them until later, and we don't want to be later in the game. So if you stop any type of contraception, 3 months have gone by, and your periods are not regular yet, go see a fertility doctor or your OB/GYN and start the workup. Thanks, friends, for being here. I always appreciate your support of this channel. I would love it if you would subscribe, share with friends, or ask questions below. As always, you can get more information on my other videos and resources.